Okay, good evening, everyone. My name is Rob Hatton. I'm the Communications Manager with Grey County. Joining me on the call tonight are Jennifer Cornell, Grey County's Director of Long-Term Care and Senior Services, and Dana Leach, Grey County's Clinical Specialist for Long-Term Care. It has been a little while since we've last spoken, so it's good to be back in front of you tonight. Just before we get going, as usual, I'll do a few housekeeping things. First off, I do just want to note to anybody watching live tonight or anybody who may be watching a recording later on that the call tonight is focusing on Grey County's 3 long-term care homes, Lee Manor, Grey Gables, and Rockwood Terrace. If you're watching and you have any concerns regarding the care of a loved one in another home, we would encourage you to contact that home if you have any questions. And our call will be recorded tonight so that it is available after, and we'll send a link out following our meeting tonight to everyone so that that can be shared around. And once Jen gives her update, we will go to a Q&A portion of our meeting. I do ask you to use the Q&A portion of the Zoom tool if you can. That's just easier for us to keep track of questions without missing any, and we'll get through as many as we can tonight. If you do happen to have a question following the meeting, you can always email communications@grey.ca or reply to one of the newsletter emails that we send out to you through our MailChimp service. And those emails will come to us and we'll make sure that we forward those on to the appropriate contacts so that we can get back to you as soon as possible. And I think that covers all of our bases, Jen, so I will pass it over to you for the update.
Great, thanks. Oh, I'll bring my notes in front, except it's not letting me bring my notes in front. Oh, there we go. Technology. All right, thanks so much, Rob. It has been a little while. The last time we met was October 25th, so lots has happened. This update is going to focus on an update around co-design, a little bit of update on the Ontario budget that just dropped yesterday, Rockwood redevelopment, accreditation, and the RNAO best practice clinical pathways. So I'll get right into it. As you all know, Color It Your Way is the foundation of the work that we do, and we've made a formal commitment to be sure that we make space for residents and families, caregivers to be part of the care team. The language that the sector is using about this is co-design, and it's really just making sure that we use a lens in all of our decision making, in when we're having conversations, making decisions, planning, anything to do with the home or individual residents, that we make space to ensure that the resident and their designated care partner, family, friends that they wish to be involved are involved. And I wanted to share 2 recent examples of this very intentional work. So the ending of the enhanced masking. At the beginning of March, resident council members, families, and team members were consulted using it was led by the IPAC and Wellness Leads to discuss the March 4th update, ending the enhanced masking measures that the Ministry of Long-Term Care released. They used the IPAC long-term care ethical design decision-making framework, and they went armed with questions and the changes to the masking directives, and talked to residents, families, and team members. And that group recommended then to the senior leadership that our 3 homes do align with the recommendation of the Ministry of Long-Term Care to end the universal masking measures. And they wanted to highlight that Grey County homes will continue to remain mask friendly, and that we'll continue to have those masks available in all sorts of places. But I wanted to share that as an example of us making an intentional effort to be sure that we're including residents and family and team members so that we can hear their voice in these important decisions. Another example is the door wraps in Grey Gables in the Behavioral Support Transition Unit. And this is just hot off the press. Grey Gables received some one-time funding from Ontario Health West to enhance and support the resident experience of residents living in the Behavioral Support Transition Unit. So in consultation with residents and team members, one of the purchases was installed this week. These are door wraps, so it's vinyl wraps that transform each resident's door from the traditional long-term care, all the same style, to unique neighborhood style front doors. This helps with wayfinding, sense of pride and ownership in having one's own space that's easy to identify, and creates a more home-like feel rather than institutional. So if you have a chance to be at Grey Gables, have a look down the Maple Lane home area and see the transformation. And we'll see what people's responses are and whether this is something we might want to look into other home areas in our homes. The Ontario budget update. So the Ontario budget was released yesterday. And I just wanted to share some important updates. Overall, it's a really good news budget for the senior sector. And we're really pleased to see that it reflects many of our advocacy asks, in particular, staffing and capital funding. And so I'll just highlight some of them. We're still waiting for specific nitty-gritty details, but some high-level update. Level of care funding, which is one of the baskets of funding that the province provides. And we're really pleased to see that they're providing a 6.6% increase to the level of care funding. To give you an example, we budgeted, because we don't know what the announcement is going to be, and so when we're putting our presentations together, or our budgets together, we have to kind of guess what the level of care funding will be. And so we budgeted 1.5%, and we've actually received 6.6%. And that's a $353 million increase to the level of care funding. We're expecting to see more information about the specifics and the details, and we'll pass that on as soon as we know. Pharmacy funding and medication safety technology program. So you may have seen in our newsletters, MSTP is the acronym for Medication Safety Technology Program. It's broadly an initiative to ensure that we're providing the safest, that we have the safest program in terms of medication management and distribution and how that works. And so we expected that funding to be ending. It's actually being continued. Health Human Resources, the 4 hours of care. We've talked a lot about that over the years. And we have learned from the minister's office that the 4 hour of care allocation for 24-25 will be $1.82 billion. And as part of that, this funding is going to be built into base funding moving forward. So we're expecting, again, more information about what that actually means for each long-term care home as opposed to the broad sector. But it's a significant investment, and having the confirmation that it's built into base funding, that we can expect it year after year, makes it a lot easier for us to budget and plan and provide consistent staffing for our residents, but also for people who work with us, so that they know that their job is going to be funded going forward. Behavioral support units, an additional $46 million over 3 years to support the continued operation of 59 behavioral specialized unit beds. So I want to highlight that our 18 rooms at Grey Gables on Maple Lane in the behavioral support unit, those 18 are part of the 59 in the province. So it really is a unique program that we've been running, and there's a lot of reporting required, and one of the reporting is an annual review of how things have gone in the year before, and their statistics and stories that we share. And I firmly believe that program is a valuable, useful, meaningful program that makes a difference in people's lives. And as such, the province is adding 200 new BSU beds to expand this care for individuals with complex needs across the province over 3 years. So I think that we should be very proud of the work that we've done to demonstrate that this is a meaningful program and needs to be scaled and spread across the province. Home and community care funding. This isn't specific to long-term care, but it matters to long-term care, and I know it matters to all of you. Long-term care can be the answer to lots of challenges in the health system, but not all the challenges. And adding investment into the home and community care programs and services that are available will help the entire system. And people want to live at home as long as they can. And so this budget is investing an additional $2 billion over 3 years in home and community care. And I can't remember a budget that has had that significant of an investment in home care. And I'm, as a human who lives in Ontario, I'm really pleased to see that. Capital development, I saved this one for last because it's so exciting for us and it leads us into the redevelopment update. The government did announce that they're investing $155 million into the capital construction program. And so it's time limited top up funding of $35 per bed. Either way, it's really great. And this is the second top up, one-time top up that was offered. The first one that was offered, our Rockwood Terrace redevelopment didn't quite meet the eligibility timeline. And so we're waiting for all the details, but are feeling confident that the Rockwood redevelopment will meet the eligibility criteria to receive this top-up funding. It doesn't change anything in terms of the design or the timeline for the rebuild, but it does have an impact in the amount of money that the taxpayer bears in building the Rockwood Terrace new build. So it's more of a equal share. Equal is probably not a fair or safe word, but it's more of a share is offered by the province than Grey County. So it's really good news, and we advocated very strongly for that. And that leads me to the Rockwood redevelopment update. If you visited lately, you will see that work continues on the site adjacent to the existing Rockwood. That's called the early site works, and it's putting in services, roads, moving earth around. And there was a lot of earth to move around, and Rockwood Terrace didn't get its name by accident, so lots of rocks to move around as well. We received the next stage of approvals from the Ministry of Long-Term Care, and the tender for general contractor has been out and closes next week. So things are moving along, and watch for updates, because the next thing will be awarding the general contractor, and then I don't know whether, Rob, you might have to help me, whether we call it a sod turning but where we put the shovel in the ground and we go take pictures, and that will be later in the spring, early summer. So watch for that. Lots of excitement.
Having been to the site, Jen, I can say that we have missed the sod turning because the sod is all gone.
Right. Okay. So we'll do something with the fancy shovels or something. Accreditation. We have really ramped up with accreditation. Lots of background work has been happening for some time, and now it's much more out in the homes, and people are talking about accreditation. I want to thank everyone who's participated in the engagement sessions, reviewing the accreditation standards, and providing input as a resident, a family, friend, or a team member. We've had 4 one-hour sessions where we reviewed a number of standards and indicators, and I really appreciate the feedback that's been provided from those discussions. Watch around the homes. There will be "Did you know" posters are going to be up, sharing information about how we're working to meet the various standards. The survey dates have been established. So on May 27th to May 30th, there will be 2 surveyors on site from Accreditation Canada. Watch for information and updates. If you happen to be in the homes during the survey between May 27th and May 30th, you can expect the surveyor to stop you and ask you some questions. Please be honest, share your experiences. It's how we improve and how we celebrate. So please do that. Oh, I forgot to mention in the summary that I was going to talk about the eclipse. I'm not talking about it a lot. I Googled at one point how many eclipses there's been in the last 100 years, and there's been a lot. And I don't think we've talked about any of them as much as we've talked about the April 8th eclipse. I just wanted to mention that we know it's happening. We've been doing planning. We have some posters to put up with some information about things to consider on April 8th during the eclipse. We have a checklist. We've done a risk management plan. We've chatted with residents. So we've got it under control. I hope, I'm confident. And hopefully the April 8th eclipse comes and goes, and we're all prepared for the next time one comes around. And that's my update. I'm going to pass it over to Denna, who's going to give an update on our RNAO best practice, clinical pathways.
Thanks, Jen. And obviously, as the clinical specialist, talking about clinical pathways is exciting. So I asked Jen if I could share, because clearly I'm very excited that our Grey County Homes have begun a 3-year journey with the Registered Nurses Association of Ontario to implement these clinical pathways. So what they are tools. They help us to ensure we're following the best practices in the province and they're based on research and evidence so that we can deliver the highest quality care to our residents. So the pathways include assessments and care plans that are directly embedded into our electronic charting system, specific to each resident. And it'll streamline documentation and support our healthcare team with real-time communication and a consistent approach. And we're really glad that it also aligns with our resident-centered care and essentially, of course, our Color It philosophy, along with the Residents' Bill of Rights. These are pathways, so each resident, based on who they are and their very own unique qualities and likes and wishes, will have their own path. Some of the benefits of using the RNAO clinical pathways is that it ensures we're following regulatory compliance, so hitting timelines, ensuring we have all the assessments required at the right time in the right place. But it's also will improve efficiencies for our staff because it'll also be a user-friendly approach using these standardized assessments that will guide our nurses through each step and supporting them in making sound clinical decisions. So it begins, there'll be flurry along with our accreditation, but this will beginning April 30th, we'll be rolling out the first of our 3 clinical pathways, and that includes our admission assessment and our resident and family-centered care tool for all new residents moving in, along with a new delirium assessment tool for new and current residents that'll help us to make very quick decisions and provide interventions that are appropriate and timely. So we're really excited about that. And following the rollout of these initial 3 clinical pathways, later this year, we'll be adding falls and pain clinical pathways, and then we'll move on to pressure injuries, palliative care, and continence. Now, keep in mind, these are all the things we're already doing. We have assessments. We're doing a lot of great clinical work, but this is put into a comprehensive evidence-based tool that gives us a product that we're able to work and do our very best. So it's really exciting. An exciting opportunity, and we're pleased to have a change management teams supporting us from our frontline team members with leadership and working together with the goal of a successful implementation. So you'll see more details in the next family newsletter. We've laid it out a little bit more, but if you see us talking about new assessments, or if you hear the word pathway as you're walking through the halls, this may be what we're talking about. Or if you see staff huddling around a computer together, there are some pathway champions, and they'll be supporting their peers with this new system. So we'll keep you posted on our progress as we color it with clinical pathways. Thanks.
Great, thank you.
Can I share my screen, Rob, and share you shared the link? I know we have a couple of questions, but.
Absolutely, yep, you should have the power there.
Okay, so please don't judge all the tabs I have open. There's many. So this is the link that Rob shared in the chat for the Special Redevelopment Rockwood page. And I'll try not to make you nauseous, but there's lots of updates and information. There's a rendering of the proposed design, some of the key service features, highlighting some information about some things that topics that we spent a great deal of time talking about and planning for, funding. And then here there's a video of the earthworks. And Rob, can you remind me that? So if we look at this picture, that rock next to the bus, like that's a big boulder.
It is. The photo doesn't do it justice, but it still looks pretty big from there. If you also look across to the bulldozer around the center of the screen,
Oh my
it's
God.
massive.
So there's there's a video, and we're doing one of the benefits of being part of an organization like Grey County is that we have people who are skilled and licensed, because I think those are rules about drone usage. And so we've been flying the drone over every once in a while and getting some footage to be able to take updates. And is that the curling? I'm geographically challenged.
Yes, that's the Durham
Okay.
Curling Club building.
So that's the curling club, and Rob has contacted and been in touch with people at the curling club who have agreed to partner, and we're putting up a time-lapse camera, and maybe it's up already, and we'll be able to do time-lapse photography as well of the project as it moves along. And then there's some renderings. I called them artist renderings, but that's not true. I think they're digital renderings. And so there's some examples of proposed dining room that you have to scroll along the bottom to see the different design renderings, and then lots of news that is related to it. So I'll stop sharing, but thanks for adding that link, Rob, and it's pretty exciting.
Absolutely.
It all sounds easy, but that's I don't even know when we started this, years ago. So
I started in 2014, and redevelopment was one of the first big agenda items that we had on the docket back then. So it has definitely been a journey. Okay, well, we will jump into some questions. We do have a couple submitted in here. Thank you very much. The first one, yes, and the door wraps, that was news to me as well. Can a photo of the door wraps be made available in the newsletters?
Yep.
Yes, we can make that happen, and I will see if we can get a little bit of a story around that one on Facebook as well, if we can get some pictures. And the next question, as a family member, I'm not aware of being able to participate in the accreditation process. How did this happen? I just wonder, Jen, can you talk a little bit about how we've communicated out the accreditation so far, and maybe some of the opportunities that have been presented?
Yep. Thanks for that question. So we have provided some regular updates in newsletters. There's been some posters in the home. I believe each home has a board dedicated to, like a bulletin board dedicated to accreditation. And for the involvement in the accreditation, the review of the standards, we did an expression of interest and we sent it out. I believe there was a poster, and we sent it out also through Clinic Connects. We didn't send it out as a MailChimp. The challenge with the MailChimp process is that it's, and Rob, you can help me because I'll just make up words about what it is, industry words, but it's anyone can subscribe to the MailChimp. So when we use the MailChimp, we treat it very similarly to a media release, because it's going to anyone who has ever signed up for it, as opposed to just people that are directly involved in residents' lives, like designated care partners, family, friends. So we used Clinic Connects to communicate the opportunity. And I'm not sure if we sent it out through the designated care partner email distribution list or not. And so if we didn't, that's something we could add to future opportunities. But we did an expression of interest, and I can't remember offhand, but I believe we had about 20 individuals who responded interest and have participated in some or all of the sessions. There will be opportunities to be involved during the survey, and so we'll make sure that we put posters on the accreditation board so that you can see that when you're in the home.
Excellent. Thanks, Jen. And just so everybody's aware, we're not going crazy when we say things like MailChimp. That's the name of the email tool that we use to manage our contact lists at Grey County.
Thank you.
All right. And just to follow up to that, Jen, if someone is only receiving those newsletters that we're sending out through email, with MailChimp, is there another way they can sign up for Clinic Connect?
So Clinic Connects is currently the substitute decision makers, and I believe with our agreement with Point Click Care, which is who manages Clinic Connects. It's a module part of Point Click Care. I believe we can only have 2 people receiving Clinic Connects. What I will find out, because I don't know offhand, is if someone receives a Clinic Connects, if they can then forward it to their family members and friends, because that's the process that we have in place. And this was one of the things we talked about with the residents and family members, was that usually when we're communicating information, it goes to 1 or 2 of the designated recipients, so a substitute decision maker, power of attorney, and then that individual shares it out with the family. So if there's a family with 4 or 5 siblings, then the one person receives the information and shares it out, and they have a system for that. My call a friend is working here, so I may get an update on that. So what I'll commit to is finding out how that information can be distributed to the bigger group by the person receiving it, and we'll add those instructions in the follow-up.
Great, thank you very much. The next question. What design changes were incorporated into the new construction at Rockwood Terrace due to COVID realities?
That's a great question, and there was no limit to using an infection prevention and control lens to all things. So where we would have talked about that before as something that's important, it might have been limited to how we deal with laundry and soiled utility rooms and a bit of and outbreak management from our experience before COVID. Now it's a lens on everything. Door openers. So door openers that you just wave your hand in front of and the door opens automatically, instead of every person traveling that space touching that door handle or the door opener. We spent a lot of time talking about the IPAC PPE and how that could be available at every room, but not visible as a part of the decorating scheme. So how could it be available, but a little bit more hidden? We will also commit to having a virtual town hall just about Rockwood redevelopment, and probably that'll be around once the general contractor's in place, so probably summer-ish, and we'll invite Karen Kraus, who is the executive director at Rockwood and has taken a lead role and been at every single one of the meetings, and there have been plenty in talking about design. And we can talk all things redevelopment. The other thing, Dawn, to answer your question, that was really significant in terms of design was the resident rooms. And we in the legislation and in design, we can still have basic accommodation, which is 2 people sharing, semi-private, which is 2 people sharing, and private. So what we've actually done with this design is we have private and basic. We aren't going to have semi-private, because semi-private and basic feel the same. And we are not having two people share the same space. So a shared room, a basic accommodation, is each person has their own bedroom space with a shared bathroom. And then there was lots of thought about how people travel from their space into the bathroom, and making sure that we're looking at all sorts of infection control. How is there touch surfaces? Is there hand sanitizer available? Is the lighting, which is an infection control, but is the lighting good? Can you see the bathroom door from your bed to make it easier to remember when you get up that that's where you were headed? All sorts of, it's amazing. The design team, which is Kasian Architect, was infinitely patient and very thoughtful about asking us every question they could think of about the experience of the people working in the space, and the experience of the people living in the space, and the experience of the people visiting in the space. And we talked about those experiences for almost every decision that was made.
Very good.
No, I don't know. I don't think they'll have self-flushing toilet. I don't even know that. Sorry, the question is, will Rockwood have self-flushing toilets? And I don't know. I don't think so. I don't think we got. So here's the other thing about redevelopment. When you're early in the days and you're talking about all the things that are possible with design, the project manager says things like, but we also need to manage our expectations. And I'm not wearing my name tag, but it turns out, as the director of long-term care, I'm in charge of making sure that we manage our expectations, and that all the amazing things that we want, we can't afford to do all the things. So we always had to balance the experience and the against the cost. And then we had to make some pretty tough decisions about what are amazing things to have and what are really important things to have. And I don't think self-flushing toilets made the grade. I don't think so.
Okay. I'm not seeing any other questions here now. So I think with that, maybe, Jen, I'll pass it over to you to wrap up. But just before I do that, just a reminder that if you do have any other questions that come to your mind following the meeting, by all means, email communications@gray.ca or reply to one of those newsletter emails. Those will come to us and we'll make sure that we do get those answered for you.
Great, thanks, Rob. So thanks very much again for everyone being here and being engaged. Our plan is to have these calls quarterly. I can't remember if I said that. So quarterly, unless something urgent comes up. And I do ask that each of you think about opportunities or barriers as family members and friends of the residents that live in our home. What are the barriers or the opportunities to really being a part of the care team? I want you to think about that, and I want you to share that back with us. We really do want to know. If nothing, the pandemic taught us that hearing each of your voices guides us in the right direction. So please share that back. And thanks everyone for your time.
All right. Good night, everyone.